So we gently sort of got the erector spinae muscles to release, okay, in the previous video. Now we're gonna sort of we're gonna use ischemic compression, okay? And a lot of you guys learned ischemic compression, especially on the trapezius muscle. You found that little knot there and did ischemic compression till it released. We're gonna do it on the erector spinae muscles. Okay, now how you do this is, in between your MCP joint and your PIP joint, you're going to use the flats, okay? If you don't, you don't want to use your knuckles unless you don't like the patient, okay? But don't use your knuckles, and you want to stay away from your PIP joint. You want to stay away from your joints because otherwise it'll hurt your hand. And what you're going to do, you're going to use the flats to do ischemic compression, okay? And the pressure comes from your waist, all right? It's from your waist. You're not putting pressure from your muscles here. You're keeping a relatively straight arm, okay, a relatively straight wrist, okay. You don't want a lot of angle because the torque can cause problems there. But all you're going to do is slide. Remember the first day in OPP lab we did the skin drag test, and it would stop in certain places where you got those cross fiber adhesions. That's what we're trying to sort of iron out, okay. All right. So when I get in trouble, and let's say maybe once every 10 years I get in trouble with my wife, just kidding. I do this to get out of trouble because she really likes it, and most of the patients very much like this. So what we're going to do is we ask if we can expose the patient's back. She already said yes. And what we're going to do is we're going to put between the MCP joint and the PIP joint, right along the erector spinae muscles. We're going to put gentle pressure, and the pressure's coming from my waist. And all I'm doing is gently and easily putting ischemic compression and rolling. And you'll feel, just like you did on those skin drag tests, areas that don't move that well. And like right here, there's not a lot of movement. So there's a lot of cross fiber adhesions there in the fascia that need to be worked out. And you just gently go at a nice easy rate all the way down. Good. So we come here and we come up and go a little bit into the multifidus region there, and good. Now you probably do that 3 or 4 times if the patient tolerated it, okay, if they felt like, usually patients very much like that, and she does as well, so you probably do 3 or 4 runs of that, okay? Thanks.